Composite is the filling material of choice when it comes to matching your tooth color. Composite fillings consist of plastic and glass particles. They have become the most popular filling materials because they can match your existing tooth color, and they also solidly bond or glue to the tooth. After the decay in your tooth has been cleaned, a cleansing gel is applied. Next, a bonding solution is applied, finally followed by the composite filling material. Composite is hardened by applying a high-intensity blue light. It only takes a few seconds for the materials to harden. Once the tooth is filled and the composite is hardened, the filling is checked to ensure the proper shape and look. At this point, any necessary adjustments are made, and then your filling is complete. Following the filling procedure, it is very common to experience some discomfort, normally at the site of the anesthetic or at the tooth itself. To alleviate the discomfort, it is recommended you take over-the-counter pain medication. If the symptoms persist, then you should visit your dentist. In some cases, the decay could be quite deep and close to the nerve of the tooth. In these instances, the nerve could already be infected with bacteria. Even though a filling has been placed, there is still a good chance that the tooth may need to go under root canal therapy to relieve the discomfort. Also, composite fillings may change color over time and can sometimes chip away from the tooth. Please keep in mind, the longevity of a filling depends in large part on your oral hygiene and diet, so be sure to maintain your filling with proper brushing and flossing. If you have any additional questions, please consult your dentist.